The COVID-19 pandemic has resulted in lockdowns in many countries around the world. Organizations have had to social distance their workforces, with many working remotely from home. This has made the development and commercialization of critically needed PCR-based and serological diagnostics especially challenging. Such work, conducted by many life science labs 24/7, involves the rapid and precise handling of precious samples, development and optimization of a wide range of assays, and their subsequent validation. Required automation solutions involve in situ setup of both the liquid handling robot and the programming of exacting experimental protocols, necessarily involving frequent adjustment and optimization of essential pipetting operations. But how can you do this when your research team is largely located in remote home office locations, distant from the laboratory? The Andrew Plus liquid handling robot and OneLab cloud native software has been designed very much with these sort of challenges in mind. But rather than hear it from me, I have the great pleasure of talking to the team from Mammoth Biosciences, located in South San Francisco on the west coast of the United States, who have an especially valid and very relevant use case for the development of a novel COVID-19 diagnostic based upon their expertise in CRISPR gene editing technology. With me are Tisch, Chief Operating Officer, James Broughton, Research Lead, and Carley Hendriks, Research Associate. Ted, before we learn more about this exciting application, it would be great to learn more about Mammoth, in particular, what brought the four founders together with CRISPR gene editing luminary, Jennifer Doudna.
It's a really good story, and as people in the industry know, that CRISPR's been really focused on in the research aspects for 10 years now, and really in the, I'd say, the commercial public arena since 2015. And in that time frame, Jennifer's lab at University of California, Berkeley has discovered new enzymes beyond Cas9, which she's most well known for, and the probably first mover Cas enzyme in gene editing and in the CRISPR space. Over this time, new Cases have been discovered. Obviously, these come from responses, bacterial responses to viral infection, and this is the way that the bacteria remember the infection, can respond to it. Well, human cells have this, and other cells can respond this way. Cas12 and 13 were discovered, and in her lab, the mode of action and the mechanism was figured out. And in this case, these two enzymes have a way of having a secondary action, not only recognizing the target sequence in the DNA or RNA, but also can report a signal when they do engage. And so this is really important, because instead of just having a Cas that gives you does editing, you can have a signal that comes when you recognize the sequence. So this lab has been very important and foundational for bringing CRISPR enzymes ahead. Two of our co-founders, Lucas Harrington and Janice Chen, were fundamental in discovering the mode of action of Cas12 and 13. And when Jennifer Doudna and our CEO, Trevor Martin, who, as he, in his own words, said he constantly hounded Jennifer to start a company about this, it really fit in line with Jennifer's idea of democratizing the Cas enzymes and putting it into as many applications as possible. So that team of four, Jennifer, Janice, Lucas, and Trevor, formed the company in 2017. And our mission is this, and just very quickly, is that we're a protein discovery company focusing on Cas enzymes, and then taking those enzymes, understanding the mode of action. And there's three buckets that they go into. There's gene editing, they're cutters. The other side is what we'll talk about today, the diagnostic side, the reporters. Or you can do modifications on them, and they have interesting actions of modulation of the genome. So our company is focused on that, and today we'll focus on the diagnostic side.
In general, one of the biggest opportunities was an opportunity to really explore the power of CRISPR in terms of diagnostics. we have this kind of, at that time we had like an emerging pandemic, and we really took it upon ourselves as a challenge to quickly and very rapidly develop a diagnostic test using our technology for coronavirus. But at the same time, we were also facing challenges in terms of, with the shelter-in-place order, in terms of really, having to reduce the number of people that we have in our lab, while, with the overall goal of keeping all of our team members safe, but also trying to keep the lab productive in terms of actually moving forward with building a coronavirus diagnostic that could really, hopefully impact the world. So one of the main issues with like current molecular diagnostics is often you have to send these tests out to centralized labs where it takes 24 hours to get a result back to a patient. And one of the things that's really been driving the Mammoth's work is really the dream of like democratizing diagnostics. How do we bring diagnostics to people and the kind of the power of molecular diagnostics to them? And CRISPR really enables us to do that by kind of reducing costs. It's a separate kind of supply chain from current diagnostic tests. And the test we developed uses a visual readout, which makes it much simpler for people to interpret the assay, and doesn't require as much expensive machinery like that's required in a centralized lab. And all of this is like really leveraging the specificity and the sensitivity of CRISPR enzymes, where you really have the enzyme interrogating its target and providing a much cleaner result than you do with traditional molecular diagnostics.
And I can imagine that trying to develop a diagnostic in the environment as you described, going into lockdown, and all the challenges that must bring. While many researchers around the world continue to uncover the biology of the disease, is really quite challenging. Were there any concerns about your proposed approach here, given all of this?
Yeah, I mean, I think the biggest concerns to us were like how can we safely get samples, work with them, and also, as I mentioned before, like how do we keep everyone in our team safe and really moving forward with our experiments as best we can during these kind of challenging times.
How hard has it been to procure and manage samples? And what about the implications in terms of access to biosafety infrastructure?
We've been very lucky. We were able to work with one of our scientific advisory board members, Dr. Charles Chu at UCSF. And he, California is one of the first states to have infections. And we were able to work with him to get access to some of those samples to really kind of drive our test and really bring, the confidence that our test is being sensitive on real patient samples and not just contrived material.
So drilling into the research work itself, what does the assay optimization work actually involve?
Yeah, I mean, with any assay, like we're striving to make something as sensitive and as fast as possible. And so that really involves, testing a variety of materials, testing the combinations of those materials. We use techniques like design of experiments, and, team members like Carley on our team who's really, helped drive, those assays forward and has been able to do that remotely, which has really been great for us. So one of the things that, we struggled with is like, some of our team members are working primarily from home or like, not able to come into the lab every day. And so we were trying to figure out ways that we could really, keep the lab moving and keep them, those team members engaged with the science that's going on and keep everything going. And the Entry Plus really allowed us to do that by, one, the software is, cloud-based. So we were able to kind of design experiments remotely. And then, Carley was able to work with another research associate in the lab and to kind of set up experiments on the Andrew Plus and then execute them remotely. And so we actually had set up a webcam so that Carley could watch the equipment run and be able to stop it if anything's going wrong, so that other people can keep doing their experiments and not have to keep an eye on the equipment.
Carley, how did you feel about this? There you are. 1 minute you're in the lab, the next minute you're working from home. And then, how much experience did you have with the OneLab software?
Yeah, so at the start of, the shelter-in-place order and kind of this understanding that I would be working a lot more from home, which is not something I've ever done because I'm primarily, a lab worker running experiments in the lab. It was, a little bit of concern to think, okay, how do I stay on track with my projects? How do I continue contributing to the team and everything like that? And so when I was approached with the idea that, we have the Andrew Plus in the lab, as of a couple weeks ago, it was pretty underutilized. Would I be willing to kind of take the helm of getting it, on board and operational for our lab? I was ecstatic because that's the idea of being able to do lab work, but from home. And so in terms of, the experience I had with OneLab and Andrew Plus before, was pretty limited. We got our system installed, I think, in January. So I had attended kind of the initial installation seminars and kind of walkthrough of the software with our technician who came in. It wasn't a long time to get it up and operational and to learn the software and to start writing protocols. From the time, like I said, when I was approached with the idea of kind of taking on the Andrew Plus as my hands in the lab, to when I was executing my first protocol was, I think, just a matter of days. And that includes the fact that I have like other things I work on. With now kind of our institutional knowledge, we've got a couple of operators of Andrew Plus. We could easily incorporate any new member of the lab, I think, probably in the same day. I mean, importing a protocol into OneLab is very intuitive. You can start with pretty much any spreadsheet you want, and a simple matter of copy and paste and some click and drags, and now you've got a protocol written. So once that's up and running and operational, and we've kind of validated and make sure, all the cut and paste, the menial quality control there, I contact, one of my colleagues who is in the lab that day. And then between the two of us, we coordinate what reagents we need, where they need to go, what dominoes, and the OneLab software walks you through all that as well. So you can kind of just do a Zoom call, share screen, and we're both walking through the setup. And to date, I'm going to regret saying this, but to date, I've yet to have an experiment fail on the Andrew Plus.
That's very good to hear. That's fantastic. I'm sure that Andrew will be very happy to be helping in that way. Now, OneLab captures the execution of each step of a protocol executed. So it's a useful capability. So in effect, you have a full recording, a full trace of everything that's been done, which also provides a means of troubleshooting should you have any problems, although perhaps you haven't. Did you get the chance to take advantage of this capability?
As of right now, I mean, as I just mentioned, I haven't need to go through step by step and see where any sort of fail point was. But as of right now, the traceability is helpful because it's a file you can download. It's a file you can share. So if you needed to send it to someone else, you can that way, even though OneLab's all cloud-based. But the main benefit is that you can download that file and you can put it into, we work with like electronic lab notebooks. So I can have a document in my lab notebook that includes, the work I did on Andrew, and then in subsequent steps as it moves to other machines or processing. So they can all kind of be in one place.
So you've had experience putting a protocol together, setting up your bench, if you like, your virtual bench, choosing the labware, absolutely, defining the pipetting steps, setting up any required actions. Having gone through that and having executed a protocol remotely on the robot, which is in the Mammoth lab, what's in your opinion are the really unique benefits to this in a world, of course, that's increasingly automated, if you like?
I think so. The unique benefit, I think, in this specific time of shelter in place and work from home, the biggest benefit is that Andrew Plus becomes another lab worker when we have kind of limited space and limited number of people allowed in the lab at any one time. It's a worker that doesn't need 6 feet of social distance, doesn't need to wear a mask. It's, it helps increase our capacity when we're kind of limited at the moment. But moving forward, as we start, returning to more normal times, quote unquote, it has the ability to increase, capacity even when we're at full operational levels, because it's easy enough to set and then you can walk away. A lot of the tasks that I'm doing would be very kind of menial and tedious if you're to set up like an entire plate of reagents or something all by hand with like very slight differences in conditions. So it's, it helps save my thumbs from pipetting, which I'm happy about. And
Well, that's always a good thing.
I know, yeah. And then it's really a way to, I think, improve and increase our, throughput even in more normal times.
So if you were to think based on your experience, what sort of things would you like to see in the future? In the software, in the robot too. Any particular thoughts on that?
Yeah. I can think of a couple of like quality of life improvements to the OneLab software. One thing is, when you register your robot, and as you get new dominoes, you register your dominoes to your kind of system and your OneLab and everything, but there's no way to filter labware by what is compatible with the dominoes that you have. So that would be something I'd like to see, is that kind of ability to sort by what is available to you, and actually your specific workspace. Let's see. Better integration, I think, with kind of lab notebook softwares would be good. If you could kind of set up your reagents and everything in your lab notebook and import directly to Andrew would be a cool feature to see.
So out of curiosity, are you aware of any other groups working in a similar way during this challenging time?
I mean, I think I know of a lot of groups that are, on the coronavirus diagnostic side that are turning to high throughput solutions, big automation platforms to really increase their throughput. But I don't think I know of anyone that's really kind of leveraging kind of something where people can work remotely and still execute things in the lab. I haven't heard of any groups doing that to date.
Oh, that's fascinating. You could be setting a new trend here. I think probably, I'm sure we'd all admit there's an awful lot of lessons to be learned in general from the response to, of course, COVID-19. And I'm sure a lot of new best practices as we move into that time beyond it. Apart from the COVID project, how else has Andrew Plus supported the work in your lab?
Yeah, as Ted mentioned, we do a lot of protein discovery and other genome editing projects, and I think one of the main things that Andrew's been really great for has been the hit picking and kind of reformatting plates, and kind of making sure that we pull the successes and kind of condense them into new saved formats and things like that. So enabling those kind of experiments has also been really great for us.
I know you've got experience with the Andrew robot. If you had to sort of think about the difference between the Andrew Plus and the Andrew, how would you explain that to another Andrew user? I use that carefully because people often get confused. But somebody else using our original robot, how would you really speak to the differences with the Andrew Plus?
I mean, I think the original Andrew is it's very kind of slow and methodical because it's using kind of normal handheld pipettes. I think with the Andrew Plus, I think Andrew Alliance in general listened to a lot of feedback in terms of the speed of the system, and it's gotten a lot faster in terms of using electronic pipettes, so it's not constantly changing, having to go back and manually change volumes and things like that. I also think the cloud software has really kind of there's more constant updates, which I think is nice. And I think, but for both systems, I would say they're very, and one of the things I like about them in the lab is that they're very walk-up friendly. You don't have to be an automation engineer to use them. And I think, for me, I think having systems that are flexible and friendly for anyone in the lab is important for us.
Thank you very much, James. Great insights. As Carley mentioned, she wrote and executed the liquid handling protocols required for the Mammoth assay optimization work from her home office, whilst monitoring the robot in the lab via Zoom. In order to give you an idea of just how easy it is to set up a protocol in this way, using OneLab and executing it remotely on the robot, I'd like to close with this recently taken video clip. It features several of our sales managers, Alma, Omanovic, and Jasper, Eaton, giving a demonstration of the remote setup and operation of the robot. The Andrew Plus workspace is set up to run a serial dilution, a commonly used and very important liquid handling protocol. It has been set up in OneLab by Jasper, who then proceeds to execute it remotely in Alma's home office location, of course, hands-free.
Today, I'm going to ask my colleague Jasper to execute the experiment on my behalf. So as you'll see in the second half of this Lunch and Learn, our software is a cloud-based solution, which means that Jasper can remotely control Andrew from his apartment. So Jasper, do you mind clicking the execute button?
Of course, but before I do that, I just want to prove to everyone that it's not you that's doing any funny business behind the scenes. So please show me your hands, Alma, so that I know that you're not using that you're not doing it on your computer. So I'm on the experiment here in OneLab, and I'll just click on resume myself.
There we go.
And we'll see later that I was really the operator, logged and documented as clicking resume.
Yeah. So the idea here, especially in today's time when we have rules for social distancing that we have to respect, really the idea is that you could have maybe one person in the lab, one technician, who is there to set up the starting reagents, and then everybody else could be working on their protocols from home and really monitoring the progress of their work from home.